Hi, it's Mark from TLR. I'm here with Wil Seto of Insync Physio in Vancouver. Many time winners of Best Physiotherapists in Vancouver, is voted by their customers. And we're talking about lower back strains today. How you doing, Wil?
Hey, I'm doing well, thanks.
This is, I'm sure, I know because our business is to look at this kind of stuff, that this is something that's searched for. So it happens to a lot of people. I guess even everyone has some sort of lower back problem in their life. Is that accurate?
Majority of people for sure. I mean, I think, there's a certain degree of it. It could just be like something where you feel a little bit soreness, a little bit of mild discomfort or something like that, to something that might be a little bit more, but still on the moderate to mild side where it's hampering your function.
I'm sure there's many kinds of strains and causes. Can you outline some of those?
Yeah, so one of the biggest things that most people come in when it's more severe, they think of like, oh, did I herniate a disc or did I do something really serious? So that's definitely a possibility when you strain your back or when you hurt it. And then a big part of what you want to consider when you think about what kind of an injury it is like, what were you doing? Like what happened? And I think a lot of what I've been seeing lately too, just with the pandemic and a lot of people working at home, is more or less the herniation and people coming in and they're just doing a lot more sitting and it's more postural and they end up having more on the other end of the spectrum where it's not a disc. I don't want to downplay it, but it's less severe than a disc. Disc injuries in themselves can also be minor as well. So sometimes you might not even get back pain, interestingly enough. And to say that you don't have back pain when you're getting a disc injury, it all depends on the symptoms that you're getting and other things. You might have like a lot of neurological things like gross weakness. And so those things need to be looked at and addressed. So with some of the clients that our physio team's been seeing lately, we've had people that have been coming in with more sort of minor back stuff where they can move and function, but it's still affecting their capacity to do things at 100%. So for example, a rock climber who, he had just gotten a new puppy and basically he's been experiencing some more back pain. It could be disc. It could be maybe like a smaller joint. So the disc is basically the joint in the middle of the back, but then it could be something that's more minor, which is in the smaller joints of the back. And that's usually more common. So if you're overstraining your back and you're not getting enough sleep, and then a lot of things where you're just utilizing your posture in ways that are basically not optimal in sitting, it could be that. And with this individual, and then with another individual I'm thinking of too, that, he's doing a little more shoveling, it's a little joint in the back. I mean, it could be, like I said, again, a disc, but then when we assessed it, it definitely looked like it was a little bit more into the little joints in the back. So in terms of actually figuring that out, there's certain tests that we do. You touch and feel the area, and there's certain tests that actually indicate whether it's this or that. And those are really important to also kind of determine if it's this or that, or if it's even something more serious. So with something that's a little bit more involving the smaller joints of the back, there's certain things that we do more specific around the rehab and treatment.
So symptoms can be just pain or weakness in the back or in the legs. Is that kind of fair?
Yeah, and even when you strain these little joints in the back called your facets, you can actually even have like a limp. And it can be from like a mild degree of it to like something more severe where you can barely walk. So that's why it gets really confusing, where you're kind of like, oh, gee, did I really hurt my back or what's going on? Because when you have swelling in those little joints and it becomes a little bit more than just a mild irritation, then it can cause compression in the nerves that come out between the vertebrae of the spine. And so then that can cause radiating pain or pain to shoot down or other symptoms that may mimic something more like a disc or whatnot. So you have to really get that looked at if it goes on for more than a few days.
So once you've kind of got a history, here's what the possible cause is. We've diagnosed what we think the issues are. Then what's a typical course of treatment?
Yeah, so if it's these little joints called the facets, and then the muscles all around there being really spasmy, the first thing that you want to do, and especially like, you've been suffering for this for a few days now and it's still quite sore, then it's really important to actually work on pain management, because you really need to get yourself moving. Because if you don't really address that pain, and I'm a component of really doing things more naturally and just making sure that you don't have to take anything for it, or to just do things on more of a natural basis for exercise or hands-on treatment kind of thing. But you really got to address that pain. And you definitely don't want to be going on bed rest and trying to stay bedbound. Definitely not more than like 2 days, for sure. You get a lot of deconditioning effects and a lot of negative things going on when you're not trying to modify your activity and modifying your posture. And so doing those modifications initially are really helpful. And then doing some active mobility things that just get things moving initially is really important. So in terms of getting stronger is also important, like doing little things in those first 72 hours after the injury, because you don't want to be totally deconditioned. That's really important. So that's huge, because a lot of people think, oh, like I'm just going to just stay in bed until this gets better. And that's really not good.
So you want to stay active, and then you're going to lay out like a course of treatment, basically. How does that look like? I know it depends on what it is, but give us a range.
Yeah. So obviously with this type of injury, utilizing, like when you come into the clinic, addressing that specific area that's been injured, and manual therapy is really, really good to open things up, get things moving, resetting some of the muscle tone around there, and also helping with the rehab process by facilitating certain muscle movements and joint movements. So that's our goal in the clinic, is to help facilitate that. And then on a rehab perspective and a time, so the initial period is to just get things moving and get things activated and modifying the activity levels. That way you're not totally turned off, all the muscles aren't totally shut off, and trying to re-engage that core. And so after you move beyond that stage, then you're also looking at the pain levels coming down and things are starting to heal. And this is where you're looking at the first 72 hours, 48 to 72 hours is when you have the acute phase, you have a lot of that swelling. And then anything after sort of that 48 to 72 hours, up to even like 5 days to like a week, is kind of that period where now it's the second phase of the healing of the injury, where now you want to work on getting even stronger, and then trying to work towards more of that full range of movement that you had before. And then also one of the things that's really good to implement at this period is a little bit more cardio as well. Because as you implement a little more cardio, the blood flow really helps with the healing. And also there's been studies that have been shown that when you actually start to do more cardio, you get a little bit more fluid going in your spinal cord, and that helps with certain pain modulation, which also helps with the whole rehab process. And then now you move into like after the first week, and maybe even like the second week, as long as you're not re-aggravating it and things are kind of on this trajectory where you're healing, then you really want to look at what you need to do to strengthen it. Because the strengthening process, which we call the remodeling phase now, which is like that final phase, can last from this period where it starts at post 7 days, post 14 days, up to 3-4 months of just rehabbing the strength and getting your full, not only your full function, but preventing this from happening again. And then what usually happens, and it's funny because our physio team has seen this, is that we've seen repeat clients that come in because things have felt great, and then they kind of slacked off, and oh look, it's snowing, and then they got to shovel all that snow, and it's wet snow, but they slacked off from the rehab and they got a little weaker, and then they ended up restraining something. And there's a lot of research to show that when you aren't strong and you've had a pre-existing back injury, and then you go back to do something, and then you can really increase your chance of re-injuring that same injury or doing something worse.
So on a bigger, like 10,000 foot view of prevention for back injury specifically, what would you recommend as the steps that someone should take?
Yeah, that's a big question.
Well, narrow it to three, like here's the three big ones that you need to do.
Yeah, well, I honestly, number one, get enough rest, get enough sleep. That's huge, because your body needs that regeneration. So let's say you're doing everything else right, but you're not getting enough sleep. That is going to get you. Sleep is so important. Number two is really, I think if you're looking at sleep, eating right. So those two kind of go together, sleep and eat right. And then I guess number two would be really making sure that you keep up with some kind of fitness. If you have days where you go, oh, I got to shovel the snow, and then you're not really in shape, make sure you try and keep some form of exercise, whether it's daily walks or even just some low level fitness. And that's really, really, really important. And I think the third thing is just your posture when it comes to sitting and work. It's hard when you're working to really be cognizant of how you're sitting all the time and to really be aware. And setting timers, setting up your workstation, so that way you can change up, like from sitting to standing every 45 minutes, and having a little spot where you can stretch out for like maybe 5 minutes after every hour is really helpful. Even myself and our physio team, we even catch ourselves having bad posture. And I think that that's one of the key things, like to really prevent, things from going out, because it's the long creep effect, right? So if you're sitting there for a long time, you don't realize it, then, your back takes the strain, and then you're also checked out of your awareness of how your body's feeling. So those are the big things.
If you've got some back problems, the guys to see are Insync Physio. You can book your appointment at insyncphysio.com. They have 2 locations, one in Vancouver. You can call them at 604-566-9716, or in North Burnaby, 604-298-4878. You got to call and book ahead. They're always busy, but they are experts in this. Like I said, they're multi-time winners of Best Physiotherapists, both in Burnaby and Vancouver, as voted by their customers. People love these guys. You need to get in there and see them get feeling better. Insync Physio. Thanks, Will.
Thanks, Mark.